Explain to me a little bit what A.W.A.R.E is.
A.W.A.R.E is, I'm a patient. When I enter into the doctor's room, I need to know who I'm meeting. And so the doctor needs to announce his name or pronounce his name or her name. And he needs to welcome that patient so that patient can feel at ease. Most patients don't want to go into a doctor's office because they don't want to hear the outcome or what the issue may be. So, number A, ask if there's anything the patient needs. What does they need? What is your need? Explain what the need is. And be able to take time out and listen to the patient, what the patient is saying, instead of you coming up with a quick diagnose. Listen first. A.W.A.R.E, review what was done, explain when the next service would be, so that patient would know what we went over, what we talked about. This is the outcome. This is what I'm going to refer you to. And at the end, the E, exit with a kind word. Don't quickly just say, oh, you're a doctor, I'm the patient, and I don't know your name, and you're out the room. Instead of saying, have a good day, Mr. Jones, or have a good day, Mrs. Smith. Then Mrs. Smith or Mr. Jones, they won't feel good about meeting their doctor. This is what we were talking about, the podium. I think every patient should have access to their podium so that they can know what the outcome of their x-rays are or what their blood level was, just to get a little bit more education. If they had a question to the doctor, they should be able to email the doctor at any time or any day. Their records, just knowing about their history, instead of saying I need to go to the medical records to pull up my medical records, they can have it right online. I know that every patient do not have access to a computer, but I believe that we as a health institution should be able to provide that information for them, or even just have a center that a patient or the patients can go to and they can just pull up their information. That's very helpful. And I think that the benefit of it would be that everything would be accurate. The power of communication would improve the patient's understanding. It also will increase their adherence to treatment, and patients will adjust to better, and patients will have a more satisfied with their care. So if they have this podium and they're able to access it, I believe that's just the great benefits of it.